I'm going to speak in my first language. I was always told by the elders to speak in my language to address the ancestors. And it's the most important thing is to ask the ancestors of our peoples to come here to take part in this special event. And as one of my elders taught me is that you're not talking to the audience, so it doesn't matter if they understand what you're talking about. You're talking to the ancestors to ask them to come to take part. So I was very fortunate to be taught my language as a young man or a young boy from my parents, from my grandparents. So I still have the ability to speak it. So and one of the elders from my community, Shirley Claire, who's a wonderful woman, said you should never apologize for speaking your language. So. Wait. Chimon Gachi Mando. Chinevas, Muscada, Silla, a bounce wagon, could we Archiopa Yudlamio? And you would joke and with Dr. Cleary with Westcock. The leader has Gizzy Wickwick, the joke and Missing one. Gaki Mandat, Tosh with a look at the gedge. Lewan Chibano, Genzo said water with voted Governor Chikobazik, and Jagaki mean and listen to Wayne of joking in anyway. Genzo said a little voted Zonus Nook, Governor Chikobazik, Lewan chose a mod one. We got Chibano, much welcome to skip to me. Could we joke and when Zamagwan never skip to me? Skehawatuk, Genzosik, Yomani, Skobazik, Najigaki Mina, Listen Mina, we joke and Mina got to locate you. We want to Bedagiyuk, I'm going to obey Bison we happy to get for you nugget Magano. We want you. We want you, here's a wiggisk. Need win and yet you. What Glasnow? Can you go money to Kobazik? And there's Gaki in and Musson win and would joke him in and Dr. look at you. And I had you would joke him and Dr. Cleary to do the best of you. We want you now. We want you to wait the wagon up. We want you to bone you, to squid, to west. It was skip to make. Will much welcome to the get. We want you at legal your peers on the midget wagon. We want you look at the wagon off with a wamble. So they get your eggs skip to me. An up school with the zero. That's what's best. We want you really uncated with the way of Caesar, Juju Cheesic, the Masswood, Gypsic, to the mouse of wagon. Much welcome. Meet up to Busquan, Yona, Obad seat, Gilwayo. We went to Espedal said, Naga, Ibal said, Naga Pesesamic, mouse will make Pesesamic. We went to your bossy, yeah, you don't win to get, you don't win to wagon, you don't come in. We went to the mouse will make. Now I want to sing an old song to honor Dr. Cleary, to welcome her as she speaks. And as I joke that this song back in 1604 was #1. Casey Kasem was alive, I think. So I want to thank you, Pete, for coming, and I hope you listen, not with your brains, but with this, because as the original person from here, my ancestors who lived here for years have seen a lot of change. Some good, some not so good. And I was the one who initiated the grade 5 class from our school, from the Chief Harold Sacker School, to come to the walk. It was not a political statement. It was, I was teaching environmental science class with them, and they wanted to know what this fracking stuff was about. So I shared with them. And so they had to do some research on this. And they said that they wanted to save the earth, the water, the air, and the fire. The 4 sacred the elements will keep us all alive, safe. For them, for their children, and the next 7 generations. And we were always taught, think 7 generations forward. We have to protect what's here. And it's not just for our people, but it's for all people. For the animal world, the plant world, the water world, the mineral world, we have to protect that. I want to thank you for listening to me, and I want to sing this song to honor Dr. Cleary.
myself yet. I'm Carolyn Lubidarcy, and the presentation tonight is co-hosted by the Faculty of Nursing and the freshly formed Fredericton chapter of Council of Canadians in alliance with the Wabanaki people. Dr. Gil Storr will give the introduction. The Dean of Nursing will give the introduction of Dr. Cleary and Dr. Arsenault before they get started. Thank you.
Thank you, Carolyn. When I was asked with the Faculty of Nursing be co-sponsors of an event like this, there was no thinking about it. It was just, yeah, hell yes. As nurses, we're very concerned with the environment and the effects of the environment on health, and we practice based on evidence and helping our students and our faculty to see all sides of evidence is something that's really important to us. It also was made very easy to say yes because Dr. Cleary is an adjunct professor with our graduate program. And when Elish first moved to Fredericton, I don't remember how many years ago that was now, but I remember us wanting to get her on our graduate academic unit because we thought that she had something to offer to our nursing students because of the breadth of her experience. So Dr. Cleary was appointed as Chief Medical Officer in 2008. Once you hear her speak, you'll realize that she's not a native New Brunswicker. She comes to us from Ireland, and I think if we go back, there are lots of us who came from there but have lost our accents through the generations. She received her medical degree from Trinity College, Dublin, and came to us from Manitoba. She was trained as a primary care physician and has worked in a variety of settings in several different countries. And she believes strongly that teaching the next generation of physicians, and I add to that nurses, is part of her work, and she's actively maintained her links with us. Dr. Todd Arsenault is a graduate from UNB, and actually I'm going to pay back the Dean of Science for something he said to me just before this started. He talked about how much older I was than him, telling me he was a grade 6 when I was in university, and I think you ought to be paid back, Dean. So Todd told me you were a graduate student when he was an undergraduate student, so I gotcha. Todd went on from UNB to achieve his PhD in chemistry from McMaster University in 1992, so that'll tell you how old Dave is. He currently serves as the Senior Scientific Advisor for the Healthy Environments Branch of the New Brunswick Department of Health, and he supports the New Brunswick Health Central and Regional Office staff and the provincial officers, medical officers of health by presenting timely expert scientific analysis, review, and advice on broad environmental issues. He's worked with the New Brunswick Provincial Drinking Water Specialist and manager of the Department of Environment's Organic Chemistry Laboratory, manager of Dioxin Analysis Laboratory, and a consulting environmental chemist. So I think you can agree with me that these two people bring a really wealth of experience to help us to understand this issue that is so important for our province. So welcome, Dr. Cleary and Dr. Arsenault.
Before we get started, I just wanted to remind everybody that Dr. Cleary is here and Dr. Todd Arsenault are here to, it's not an information gathering tour for them. They're presenting us with their findings, and I just thought I'd mention this before so that while the presentation is happening, you can think of questions you might want to ask. But we'd like to keep the questions, if possible, to the health issues, related to this industry. And even if there's questions that you don't see answered, feel free to ask them, and Dr. Cleary will deal with them as she feels she can. Thank you.
See if this actually works. I did it the first time. That's amazing. Can you hear? Good. Well, thanks very much, Carolyn, and thank you, Dean Storr, for the introduction, and thank you, Ron, for the ceremony beforehand. It was wonderful. Thank you. I'm going to start. I joked with a friend earlier that I'm sort of the opening act. I'm the cheap band that you come to see first. And what I'm going to do is I'm going to give you a little bit of an overview of shale gas to sort of situate ourselves to start. And then we'll talk about the report itself. The report is that you saw on the title slide was the Chief Medical Officer of Health's recommendations concerning shale gas development in New Brunswick that was released on October 15th. So I'll talk a bit about the content of that report, and we'll talk a little bit about what is in it and what it isn't. Then I'll turn the floor to Dr. Cleary, who will give us some further remarks about the role of public health. So the first thing to point out is that in this diagram is the difference between what's called conventional and unconventional gas. We usually hear the term shale gas, but a lot of people will refer to it as unconventional gas. Natural gas is actually some of the simplest hydrocarbon molecules there are. Methane, which is the main component of natural gas, has only one carbon atom. So it's a very simple hydrocarbon atom. It's a much smaller molecule. It's a much smaller molecule than the hydrocarbons that are in gasoline or diesel. And it's in the gas phase at ordinary temperatures and pressures. So most of us are familiar with natural gas. Some of us may even have it in our homes as a heat source. And shale gas is actually the same product as conventional natural gas. But what makes it unconventional is that it's obtained in a different way. And I'm going to show you a little bit here on the diagram. If you look, it's a simplified geology diagram. I'm not a geologist, so I'm going to stay very, very simplified on this. Shale is the layer type of rock that natural gas is actually formed in over millions of years under heat and pressure and decomposition of ancient organic matter. And other types of petroleum can be formed in shale as well, such as oil. The gas, because it is in the vapor state, can actually migrate. And if the rock is porous enough, it can migrate out of that rock where it started. And if it goes through a relatively porous rock like sandstone, but encounters a seal rock, you can get pockets of gas. And then you can recover gas from underground by simply finding these pockets through geological exploration methods and drilling down into it. And it's like a straw in a drink. You just take it out. So that's actually conventional natural gas. And if we look at things like the Sable Island offshore natural gas field, that's actually a conventional gas field. There is also some conventional gas in New Brunswick in the Sussex area. There's also the possibility of what's called tight sand gas, which is similar except that the rock isn't quite as porous. And hydraulic fracturing has actually been used for a long time to exploit those types of resources in order to break up the rock, make it more porous, make the gas flow out. But about 10 years ago, the convergence of two technologies of directional or horizontal drilling, as it's sometimes called, and slick water hydraulic fracturing, actually allowed exploitation of gas that's in the shale before it even migrates out. And essentially, in order to do that, what happens is the drill goes down and turns in a horizontal or approximately horizontal direction and follows the shale layer along. But the shale is a very tight rock in comparison to some other rocks. So hydraulic fracturing is absolutely necessary in order to get the gas to flow out of it. If you want to recover gas from shale, you have to use hydraulic fracturing. So with that overview, we'll just go through some of the major differences. Conventional gas usually is a vertical or nearly so well. Unconventional gas uses directional drilling and can have horizontal laterals that can be up to 2 kilometers long along that shale layer. Conventional gas is usually one well per pad. You find the pocket and you drill into it. Whereas because the shale is a very tight rock and the gas doesn't migrate very far in it, typically what you do is you do multi-well pads. So a single pad will have many boreholes into the ground and going off in different directions along the shale to try and exploit gas from the shale. The shale will have many laterals or multi-well pads. There's less surface disturbance by doing that because you can put a bunch of wells all in one place, but it's a more intensive operation because you're maybe putting 12 wells on one pad instead of one. I already mentioned that you drill into different types of rock, and conventional gas may be fracture stimulated by hydraulic fracking in a tight sand situation, but shale gas is always hydraulically fractured. You can't recover the gas without it. And because you're fracking along these long laterals that are going through the shale bed layer instead of just going down into a gas pocket, there's a much higher volume of frac fluid that is needed in order to fracture stimulate the well. And as a result, there's a much higher wastewater volume. So those are some of the differences between shale gas and conventional gas. And when we start looking at the public health aspect, which I'm going to talk about next here shortly, it's important to remember that there are some similarities between shale gas and other industries that we can learn from what happens with other industries. But there's also some unique differences. There's unique differences in terms of the technology that's used, in terms of the scale in certain cases. And there's also a unique difference in the New Brunswick context in that it's new to New Brunswick. So in that case, we have an opportunity to plan in advance, which we typically don't have with industries. So we have, I think, an opportunity to get out ahead of this game here and find out before we go down the road what's going to happen. Just to point out here briefly, without looking at the details of this slide, the colored areas, and I apologize, there's one right up at the top that looks like it's white around Campbellton area, right in the north. That's actually a gray area. But the colored areas are actually areas that are currently areas where oil and gas companies have licenses to search or leases. Not very many of them are leases to exploit, but most of them are licensed to search. But that really shows you kind of the parts of New Brunswick that potentially might be affected by shale gas operations. And this has two sides to the coin. The province isn't uniformly affected because there are certain areas where the shale is and areas where the shale is a little harder to get at. But it's a two-edged sword in the sense that both the risks, environmental risks or health risks or whatever, and the potential benefits in terms of employment or economic spin-off are going to be different in different parts of the province. So that's an important thing to remember as well. So one thing we're often asked about is kind of why did the Chief Medical Officer of Health get involved in this file in the first place? Most people say, well, shale gas is an environmental issue. Why is public health even involved? The answer to that is there is an existing process which Department of Health participates in and is involved in, but it's led by our Department of Environment, which is called EIA, or Environmental Impact Assessment. And just to center a little bit on what an EIA is. An EIA, if we use the Organization for Economic Cooperation and Development definition, it's an analytical process that systematically examines the possible environmental consequences of the implementation of project programs and policies. So when any industry, it doesn't have to be shale gas or conventional gas, any industry wants to put forward a project, potentially would have to go through an environmental assessment process and potentially a full environmental impact assessment process. Essentially what those processes do is they put controls and limits on those industries. They mandate the process and the engineering controls. And the reason that's done is in order to protect the environment from discharges, from emissions from smokestacks, from wastewater that might be going into the environment, and so on. And the assumption, of course, is that if you protect the environment, you're also going to protect human health because our environment obviously affects us. We're part of our environment. So, and that's a good regulation. It's been working well for years, and as I said, Department of Health is involved in it. But one of the things that we have proposed that's in the report is the idea of incorporating health impact assessment as part of the process as well. Health impact assessment, according to the World Health Organization, is a means of assessing the health impacts of policies, plans, and projects in diverse economic sectors
using quantitative, qualitative, and participatory techniques. HIA helps decision makers make choices about alternatives and improvements to prevent disease or injury and to actively promote health. So the focus of HIA is a bit different, and if you think of it, it's actually almost going in the opposite direction from the EIA process. We start from if we decide we're going to do a health impact assessment, we say, okay, how do we protect public health and what do we need to protect public health from? From the environmental standpoint, we can say, based on those endpoints, these are some necessary environmental protections, but there are also other types of protections that might be needed as well. Some of the ones out the left here would be process and engineering requirements, which hopefully would, in many cases, would be the same ones that you would achieve from the EIA process. That would validate the importance of them and also validate the process for EIA. Sometimes they're a little different, but generally speaking, we come up with the same, hopefully. But the difference with the HIA approach is adding that on top of an EIA approach would allow you to access other areas that are currently not part of the EIA approach. Other determinants of health is the phrase that we would use. What things affect the health of populations. Considerations that could lead to, for example, protection for mental health, protection of the social fabric, injury prevention, health promotion. We could go on and on and on about possible things that the health impact assessment might do. Health impact assessment, as we proposed, is not intended to replace EIA. It's intended to build on it. Take something that's good and make it more comprehensive. So with that introduction, I'm just going to give you a bit of an overview of what is included in the report. The first thing is that we've outlined the potential public health impacts of the development of the shale gas industry. We have not done a health impact assessment. And I'll talk a little bit more about what the distinction between that is in a second. By outlining the potential public health impacts, we've essentially listed off things that could happen if we don't take steps to prevent. So we're not saying these things will happen. The report also contains advice on measures to maximize health benefits and minimize health risks related to shale gas development. It's based on determinants of health, public health objectives, values, and ethics, which if you look at the report are articulated in the first part of the report. A sub-point on that is that we've tried to make the most appropriate advice possible, given the limitations in the available information that we had and the assumptions. For example, we've been told that there's a 3 to 5 year time frame before significant development occurs. This was the estimate that we were given from government. We've also been told and read, actually, in the literature, that New Brunswick's resource is potentially very significant. It's potentially as significant as some other major shale plays, such as the Barnett Shale in Texas. Actually, if the literature is believed, it's larger than the Barnett Shale in Texas. So there are some assumptions that underlay the report. Some of the recommendations will actually build on and enhance some of the natural gas group recommendations. There were 116 recommendations released in May by the Natural Gas Working Group. If you haven't looked at those, I suggest you do, because they're really quite interesting and a good piece of work in terms of the engineering aspect of it, which we really haven't looked at all. But in cases where we felt there was a little additional clarity needed on some of their recommendations related to protection of human health and protection of public health, we've gone a little further in our recommendations. And a couple of examples would be the recommendations about chemical disclosure to also include quantities and concentrations. Another one would be monitoring of drinking water quality throughout the lifetime of the industry. So in general, though, we didn't tread the same ground as those recommendations. So that those recommendations, which are potentially being put forward as the basis for proposed regulations, are considerably different from where we've been. The other thing that the report is designed to do is to provide information to those who have a role to play in protecting the health of the public. And Dr. Cleary is going to speak to this a little more than I will, but I just want to sort of set the stage a little bit for that by saying that this is surprisingly broad. Most people think that the health sector protects the health of the public, and that's not the case. All of society has a role in protecting the health of the public, and hopefully that will become apparent as we go through the talk. So, a couple of things to point out about what is not included in the report. The report is designed to be a report on what we feel should be done for protecting public health. It doesn't talk about how to do it, and that will come later. It's also not a review of all the potential positives and negatives. We haven't gone into economic analysis about what the net benefit might be in terms of economics. That's not our area. What we've stuck with is the public health aspects and how development might affect those. So the focus is only on those factors that affect human health. It's not a comprehensive health impact assessment of the shale gas industry. We've identified some of the things that we feel are important to be considered if a shale gas industry develops, and what should be considered in terms of protecting human health. We haven't actually done the full impact analysis. That has not happened. And I'll talk a little bit about why that is in a minute. It's not an itemized list of what to do and when, depending on the status of shale gas development in the province. It's not a commentary on the technical aspects of shale gas development. The natural gas group recommendations were much more technical in that respect in terms of going into actual engineering requirements and so on. We've stayed away from that. And the other thing that is not included in this report is we haven't, at this stage, had any input from the public, from people like you. And if you remember the definition of health impact assessment, it's a participatory process. So we haven't gone there yet. This is not yet a health impact assessment. This is an overview of what potential health effects might be. One of the reasons it's not a full health impact assessment is that there are a lot of things we don't know at present. There are quite a few things that we do know, but there's quite a few things we don't know. For example, there are data gaps that limit our ability to assess risks to public health. Some examples would be lack of population health status studies to date in other jurisdictions that have had shale gas development. A lack of chemical toxicity information on waste. We don't really know yet. Waste really has not been examined in the New Brunswick context in terms of what are the potential threats from the waste and how best to handle it. There's a general lack of exposure data in other jurisdictions in terms of how people are exposed through air, water, land, and other routes. Forecasting the extent, locations, and rate of development is very difficult. We really don't know how fast this industry might develop or how much. We know from the map that I showed you that there's certain areas where it's likely to go first. But among those areas, we don't know where it will start and where it will take off the most. And there's things like correlation versus causality in some of the literature. There's literature that you may be aware of possible health effects that have been correlated, and being able to actually pin that down right now is still a data gap. So I don't think we don't really know enough yet to do the full assessment. That doesn't mean we shouldn't be moving down that road, though. We found in our review that there were common themes about potential hazards to public health. So, for example, physical injury, environmental factors, social and economic factors in terms of how they affect your health, and so on. And we also noticed that the public discussion so far has really been dominated by chemical toxicity concerns. Most of the public discourse is really about how is this going to affect my well water. And it's not about how is this going to affect my community. It's not about how is this going to affect the next generation. We feel that there's room for a broader public discourse on that. We've noted from our review that public health officials and experts in other jurisdictions that have had shale gas development are typically either late to the table or absent in the debate. So we're actually treading a bit of new ground in many cases in terms of trying to assess public health and the issues and impacts. And that goes back to the difficulty of doing the health impact assessment as well. We know that there are economic benefits from expansion of the industry in terms of there's lots of quotes about how many $1 billion of revenue it can produce. We also know from our review that this may come with socioeconomic risks that can adversely impact individual and community well-being. And there's been some talk, you may have seen, if you've seen our report, about the possibility of whether boomtown effect is an issue or not. We've noticed in other jurisdictions that there can be an equitable distribution of risk and reward, and we also have noticed that more discussion is needed on cumulative impacts. The industry has really taken off in the last 10 years in other jurisdictions, and sort of assessing where it's going and how big it's going to be and what's the overall impact over its lifetime is actually a very difficult question right now. So there's a number of open questions. The report itself is divided into five sections in the recommendations, and they're the themes for protection of public health. And essentially, they're the protection of health and community well-being related to changes in the social environment, which, as I said, is ground that hasn't really been very well covered in the past. Also, protection of health related to changes in the physical environment, of which is your water going to be affected by the hydraulic fracturing process or the waste that come from it is only one of the questions. There are some of the recommendations that cross both of those, so the second section is actually protection of health related to changes in both the social and the physical environments. We felt it was important also to talk about protection of future generations, and thanks to Ron for reminding us about our Native people's regard for thinking 7 generations ahead. I think that's good advice in this respect, that really when we look at development of any industry, we want to be looking forward, we want to be looking at sustainability. And the fifth section of the report is about recommendations concerning implementation and oversight. And there's 30 recommendations in total. I'm not going to go over them because everybody would be asleep by the time I went through them all, but I'm happy to discuss any of them. But once the recommendations are accepted, assuming they are accepted, we need to do a number of things based on these recommendations. We feel that, and we've recommended, that there be a transparent consultative process with the public and stakeholders on how these recommendations should be implemented. We need to set up a group to oversee the implementation of the recommendations. That's itself one of our recommendations. We want to establish an ongoing dialogue between communities, government, academics, and the shale gas industry. Create a multidisciplinary advisory committee to Cabinet, and support research in New Brunswick that includes health studies, potential health effects, social impacts, and so on. We need to also, our recommendations propose that we need to be able to identify process to enable a role for local governments in planning the location of gas industry infrastructure. Process to enable a role for public health and community planning. Public health does have some peripheral involvement in that already. We're proposing a more in-depth involvement in terms of designing communities so that they are designed with public health in mind, that the built environment is constructed in such a way that it keeps public health in mind as communities grow. Planning with consideration of First Nations, regardless of whether reserve lands are directly affected or not. Public reporting on environmental health and chemical data as a component of transparency. And a more balanced distribution of the potential health risks and financial rewards of shale gas development and revenue sharing. The report recommendations also propose that the government develop mechanisms for doing project-based and strategic health impact assessments. So how do we add, and under what circumstances would we add, a health impact assessment as part of an environmental assessment? And that would be a project-based case, and a strategic health impact assessment in terms of how can we step back and look at New Brunswick as a whole
and forecast based on possible scenarios what would be the health impact assessments under those scenarios. That hasn't been done, and we propose that it should be done. Also develop a mechanism for monitoring health and environmental impacts, so the health status of the population can be monitored, and tie that to environmental monitoring so that we can determine whether there's any relationship between them. We also would like to promote and protect employee health. The employees who work at these sites are just as much a part of public health as the rest of us. And also develop mechanisms that enable us to reduce human exposures to physical, social, and mental health hazards with particular attention for vulnerable populations. I'm running a little late, so I can discuss that a bit more after, if you wish. Finally, our recommendations propose that we do some planning for how to best use our land and water resources, how to protect areas that should not be developed, and how to report on the implementation of these activities. And in a nutshell, that's an overview of what are mentioned in the 30 recommendations in the report. I'm going to close with one other idea here before I hand it off to Dr. Cleary. And I think probably what we'll do is we'll take questions at the end after Dr. Cleary's spoken. But what I want to leave you with is this idea about sustainable development. The Public Health Agency of Canada has identified determinants of health that are the bullets that are listed here. And they fall into three broad categories: social and cultural determinants, nature and the environment, and economy. So things like a person's social status, their ability to access social support networks, their education, their social environment, and so on, are all things that determine how healthy people are. Similarly, the physical environment determines how healthy you are. If you live next to a toxic waste site as opposed to living in a healthy environment, you're going to have impacts to your health. Your own biology of individuals and your genetic makeup is going to somewhat determine that as well. And economic factors can work towards your health as well. Income and employment and your working conditions all will potentially have a positive or negative impact on your health depending on how well you access income and what your working conditions are and your ability to be employed. All of those things are important for your health. The Public Health Agency of Canada lists all those bullets as determinants of health. But they've been grouped together in three categories there that actually are also known as the three pillars of sustainable development. So if you look at social and cultural, nature and the environment, and the economy as things that determine your health, sustainability is in the middle where those three areas intersect. So if you imagine for a second, imagine you've got a three-legged stool that you want to sit on. You've got to have three solid legs, or otherwise that stool's going to fall down. If you only have one leg that's strong and two are weak, or you have two that are strong and one's weak, the stool's not going to stand up. All three of them are needed in order to have a solid, stable thing to sit on. And all of these are needed in order to have sustainability going into the future. With that, I'm going to turn over the microphone to Dr. Cleary and ask her to tell us a little more about public health, and then we'll be happy to take questions if you can.
Working? Working? Okay. Excellent. So, okay. A bit further? Okay. Thank you. And thank you, Caroline and Gail and Ron, for the introductions. And thank you all for being here this evening. Todd said that he's the Warm-Up Act. The truth is that he speaks first because he sounds and is so smart that it makes it much easier for me to stand up afterwards and take the pressure off. I would do, rather than go through a presentation, I'm going to talk a little bit about where we are and how I see things at this point in time. Because there has been an evolution since we released the report on the 15th of October. Since then we've had the opportunity to do a couple of presentations, and we have been asked questions. And so what I did is frame my talk in the context of questions, and just to keep it interesting, I asked myself some difficult ones as well. So, why did you do this work? Doctors and nurses have ethical and professional practice obligations that go beyond their individual patients, and Gail referred to this in her introduction. We really need to consider broader societal and environmental issues that affect the health of people. So as part of our professional practice, we actually have no choice. It's something we must do. Although the level of engagement can obviously vary depending on your particular area of work. Now, my specialty practice as public health actually is all about creating healthy populations, and so it's clearly part of my job. And the work of being a healthcare provider, it's not always easy. Sometimes we have to give bad news. Occasionally we can give good news. But the work that we have to do is all about giving the best advice that we can, even if it's not what people want to hear. Now, when I did my presentation in Moncton a couple of weeks ago, I actually elaborated probably at length, maybe too long, about why we developed this report. And at the end, one lady said to me, she said, "You know what I like about your report is the fact that you put the people back in the picture." And she said it in those few words, and actually it made so much sense to me that I'm going to start using that, because that's actually what it's all about. It's really all about people. And water and air and money and jobs are all very important, but so are people, and so is our health. And that's why we undertook to do this work. As Ralph Waldo Emerson said, the first wealth is health. Now, what's public health all about anyway? So I thought I would frame a little bit for you the work that we do in public health, because really to have a modern and comprehensive public health system, we need to ensure as a province that we are fulfilling the 6 core functions of public health, and that is protecting and promoting health, disease and injury prevention, preparing for and responding to public health emergencies, and monitoring and measuring the health of populations. These are all things that together make up a public health system, although the actual work is delivered by many. It's not just public health practitioners. Our plans and programs should contain all of these components. And our recommendations for shale gas are designed around this approach, and so really need to be regarded as a package. A couple of points in particular that I want to go into to give you a flavour of the scope and breadth of public health around the area of health promotion and health protection. And I've tried to use examples that are somewhat relevant for tonight. The prerequisites of health, Todd talked about the social determinants of health, but the prerequisites of health were defined by the Oxford Charter for Health Promotion in 1986. And this is one of the major works on health promotion, and it was actually done in the world, and it was done here in Canada. And it described that to be healthy, a population has to have peace, shelter, education, food, income, a stable ecosystem, sustainable resources, social justice and equity. And the work of public health is really, in health promotion, is really trying to make sure that communities have these. In terms of, this is the logo they actually use. It might be a little bit hard to read on the screen, but it talks about the need to reorient health services, to create supportive environments, and to encourage people to be stronger and more resilient, and communities to be engaged and active. And this is all built into a framework of healthy public policy. So this is what the work of public health can be and should be. A couple of specific examples of the types of things that we can, and again, should be engaged in. Considering that water is such an important prerequisite and a determinant of health, it's really interesting to look at what's happening in our water supplies in the world. It's quite scary. To the extent that a very major report was tabled earlier this year by a group of former world leaders and statesmen, led by former Prime Minister of Canada, Jean Chrétien, and they're called the International Action Council, and they have asked the UN Security Council to recognise water as a top concern, and have posed the question, will the next wars be fought over water? So if we're getting to the stage of having to think about water as a security concern, we're well on the road to saying that for health we better watch out. And another example I want to use, and it's a little bit more applicable to the work that we're hearing about in our communities. And I have to thank our colleagues at the Department of Environment for this slide. And I noticed there are a couple of you in the audience. So I must say this is great work, and it's about how to promote health when you're building communities. This was an example that was proposed by a developer in 2007. And so basically it shows that if you're developing a community, there's good ways to plan, there's bad ways to plan, there's better ways to plan. So if you really want to do it well for the environment and for health, then you need to think about what you're doing. So if you were to use an example of a community like this, they had a total area of so if you look down at the bottom, imagine you're designing a community. Typical way of doing it is to put, those lots there and all in a road, and people have to drive and to get where they want to go to, and people have their space, but they're not very good for our health. However, there are ways that if you identify the total area, and you can identify the sensitive parts of it, places that should not be developed because they need to be protected for whatever reason, because they're of cultural significance, or they're watersheds, or they're wetlands, or whatever, and also identify areas that are significant. You can actually plan development, and this is all about mixed use and increasing density, and with a result that is good for our health. And so in this example, it shows that they were able to protect 75% of the land, which resulted in major carbon savings. They were able to bring in enough development to justify the use of transit systems, bike trails, and people could walk to commercial activities because there was the density to support it. There was consideration given to overheating, for climate change, and they actually were able to do a very, very substantial development in a smaller space. So this example I'm giving you, although and I'll come back to why I think that this is important for the conversation tonight, it's all about the work of public health. Also, the other area that I want to talk about is health protection, and this is an increasingly large part of our work. We do health protection programs in terms of food safety and water safety, but there also is a piece in the Public Health Act that talks about public health hazards. The definition of a health hazard is a condition of a premises, a substance, thing, plant or animal other than man, a solid, liquid, gas or a combination of them, or a noise, vibration or radiation that is likely to have an adverse effect on the health of a person. So we have a definition within our Public Health Act that clearly defines what a health hazard is. Now, typically these would not be at an individual level. These would be, a threat to a population. And there are there are rules and regulations about how we can and must respond to them. There's required reporting. In fact, if a person or an organisation believes that there's a health hazard, they have to report it under the law. Actually, it's not just authority, but there's a requirement to investigate it, and the authority to issue orders by a medical officer of health or public health inspector to vacate, close, placard, prohibit, regulate manufacturing, etc. And there's also authority given to the minister to recover expenses caused. And so this area of health protection, we do have legislation to support it. However, when we talk about an industry like the shale gas industry or other industries, typically we have not, in the past, used these provisions under the Health Act because there are questions about, well, does it apply to something that hasn't happened yet, or that is a long term or spread out, and most people think of this as something that's short term and immediate, but it's actually not entirely clear in the legislation. But it is clear that if there is a health hazard caused, then there is an obligation on us and public health to respond and investigate. And so, in terms of a legal basis to do our work should health hazards occur, I think there's a strong basis for it. So I'm going to go on. So that's about public health. So the next question I'm going to pose myself: just because there are potential health hazards, are they going to happen? And I would say that depends. All of the things that Todd identified in terms of potential health hazards on physical, mental, social, psychological threats, they are all real. They're all things that could happen, and they have happened elsewhere. Whether or not they happen in New Brunswick depends on, I think, about 5 things. The first one is how closely people are exposed to the hazard. Because risk is a function of hazard and exposure. The more you're exposed to something, the greater the risk. So if you take, for example, somebody who smokes versus somebody who's exposed to second-hand smoke versus somebody who doesn't smoke at all, the risk of developing disease decreases. It's obvious. And so, depending on how we plan for this industry in terms of reducing potential exposures, that could lessen the risk. And that's why it is so important to be systematic about identifying what the risks are and then reducing exposures. And the exposures to people are not necessarily the same as exposures to the environment. So when I hear it said that we need to develop this industry in a safe and responsible manner and in a way that protects the environment, I think that that's hugely important, because that's good. The environment is very important, and having a healthy environment will help us. But don't think that will be enough to protect people or build a healthy population. And I'm going to show you a slide that illustrates that a little bit. These are both examples of development of shale gas sites, both in the States. And on the bottom one, you can see that there are well pads. There's these oblong areas or rectangles are really storage for wastewater. There's a road coming into this one here. But it's fine. It's surrounded by trees, and so what's being exposed there, are environmental. It's the trees, it's the water, but there's not as many people in the vicinity there. If you look up on the top right-hand corner, you can see the well site right beside a church, right beside something that could be a shopping mall, and there's a baseball diamond just there at the top of the picture, so it's right in the middle of the town, and so the potential for problems are much greater, and so this idea of exposing people is really key to addressing risk. Now, one of the things that that happens with this industry that doesn't typically happen in conventional or more known or established industries is that sometimes they start off like this, but the wells themselves don't last forever, and so you know, the first couple of sites can be further away from people, but then after 5 or 10 years, when the well is dried up, you know, they move a little bit closer, and they move closer, and they move closer. And so unless you have a plan ahead of time, you know, what your boundaries are, you can, you know, be put into situations like that. So it's very important to do advanced planning and think about where you may or may not develop. The second factor in whether things could happen or here are, it really depends on how well the industry is regulated and overseen. And just because there are rules, that doesn't mean to say that they're followed and enforced. And an example of this, we could tell, well, I see one of my colleagues up there who's very much involved in enforcing restaurant inspections. We inspect restaurants here in this province. We have several thousand restaurants. We do regular inspections, and by and large, you know, the restaurants are very, very good or cooperative. They do their best. There's always the occasional one that doesn't do so well. And if you look at our website, we actually have a grading system for the good, the bad, and the ugly. I think you're green, you're yellow, or you're red. And you know, say we have 2,000, I can't remember the exact number of restaurants. At any given time, there's probably about 20 that are in the middle, and maybe 1 or 2 that are not so good. And so that's in a well-run, well-regulated industry. So the reality is that things happen. And so you really, and we know, we can tell some, or I've heard many stories about things that have been found when inspectors go out. So you have to keep on top of things. This is an example of a very nice-looking clean fridge, nice countertops that we would hope to find in most restaurants. But this is an example of other things that we've found in restaurants. So, you know, so the point is that just because you have rules doesn't mean to say you've got that it's all working. In general, laws are more effective than guidelines. Seems to make sense, but you know, but it is important that if this industry or regulations are being developed, that they're put into law and embedded in law rather than allowing sort of exceptions and workarounds and so on. And they also, in order to be equitable and have high standards, there should be clear standards set, and it shouldn't be project by project by project. Now, beyond rules, it depends on how effective the planning is. And so I talked a little bit about the need to plan, and going back to our example here, this is an example of community development. But our recommendations were saying, well, why could we not plan as communities or as larger regions and where development could or could not take place to make decisions about that are sensible decisions and not have a situation like where the industry is right in people's faces. And there's 2 more things that I think are critical to whether or not we end up having problems here. Depends on how you go about things. What you do is obviously important, but I believe that how you go about doing it is probably even more important to health, particularly mental health and well-being. And so people have to be engaged. It has to be a participatory process. People have to have some ability to influence what affects them. I think that this is something that is critical, and we've tried to address that in some of our recommendations, which deal with matters such as open and transparent communications, engagement of communities, and so on. The other point I would like to say is that we really need to be conscious about watching for health and environmental health problems. Right now, we don't do a very good job of this, particularly when it comes to industry, and our ability to link environmental and health data is essentially non-existent. So we need to put mechanisms in place to monitor, measure, analyse and report data. Is this not all fear-mongering? No. It is reasonable to consider the health of people. Our recommendation should be routine practice and not just for this industry, although this is as good a place as any to start doing something that needs to be done. But I do think we need to strive to keep the discussion factual and rational, because people need information that they can depend upon, and whether that's about economy or the jobs or about health and environment, the facts are important. One of the things that has struck me and actually bothers me is that there's a lot of labeling that's been going on. People are being described as the pros or the antis. And when I hear people, and I have talked to people, what I hear people talking about is, they're worried about what's going to happen in their community. Are they going to lose things that they love? And also I hear people worried about, are their children going to have to go out west to get a job? So I think that it's important to try and keep the discussion about what are the things that matter to people, and then try and find values and things of common interest, and that might help us find solutions. Is getting jobs also not important to people's health? Well, absolutely. And our report is not against industry, and it's not about not getting jobs. It's about doing it in a way that also protects people. How much will the recommendations cost? Well, it actually hasn't been costed out, and I think Todd went into the reasons why we haven't been able to do operational planning. We do need specific details. But in general, though, public health programs are cheap and cost efficient and much less expensive than treatment and remediation. So the cost should be affordable. It certainly shouldn't be enough to put an industry that size off. If this really is enough to meet our energy needs for 100 years, I think it's well worth investing some dollars up front. And it might be possible if we could persuade the industry to switch their apparently very substantial social marketing budget away from saying that they're doing it safe into actually keeping it safe, we might find ourselves a solution. What do you think of a phased-in approach? See, I told you I was going to ask myself. I think if the decision is made to go ahead with the development of the industry, it makes sense to start slowly and cautiously and monitor as we go. However, I don't think that means we should do it in the absence of a framework or without advanced planning. We should not do a rushed or shoddy job. Our recommendations are intended to provide the framework needed for the protection of health, and I believe all need to be considered for the planning of this industry. The degree to which they would be implemented for a couple of sites would obviously be much less than for full-scale industry, but they are scalable. And if I was to go back to their subdivision example, you set out about planning a subdivision, and I'm not an expert in planning. I think some of our environment colleagues could do a much better job explaining this to me than I do, but I say you were to, you would think that you have to think, well, what's the size of it going to be, and what are the boundaries, and what's the neighbours think of it, and where are we going to get the water from, and where are we going to send our sewage to? Where are people going to get access to communities? So you have to do the planning. You might start off with a couple of houses to begin with and say, well, we're going to see how these work, do they sell, or... but you don't start saying, well, I'm going to put up a couple of houses here and then see if we build a whole subdivision around it. It just doesn't make sense. And if we are going to go ahead with a few test wells, it will be very important to be clear about what the test wells are test off. You know, what's the hypothesis that's been tested? What are the time frames being allowed? What are the criteria that will determine if they're successful or not? Because the problem actually isn't, as far as I can see, about allowing a few well-run, well-situated wells. We have wells that are producing gas in the province already. The problem is what measures are being put in place what framework is being put in place to prevent uncontrolled rapid development that can cause problems elsewhere. And so, when will we actually do the real planning? If we just do planning for a small number of wells, do we then stop and then do the rest of the planning? And so we have to get clarity on what the timelines are that are being described. And regarding the timelines, yesterday it was announced that there will be technical reviews that need to be put in place for the Department for Environmental Management, and they're going to be ready by the end of this year. But for the reasons outlined already, they don't really deal with the health aspects, and we haven't really got started on this work. So there is lots of work to do, and as I've said already, to do it properly, it can't be rushed. So this one is about moratorium question. Why did you, or didn't you, or did you deny, or did you support, or did you sidestep the question of moratorium, depending on the esteemed media source of the moment? But actually, anyone who would read the report completely will know that we didn't talk about a moratorium at all. And there are a couple of reasons for that. First of all, the assumption given in this report was that the expansion of the industry was 3 to 5 years, and that we were reassured that there was ample time to put mechanisms in place. It was indicated yesterday that there could be activity from next year, and so that's different, and I think that's something we need to seek clarity on and try and understand the implications. But that aside, I have to say I'm wary about the word moratorium. And it's not that I have a problem with people use it, but I find for public health, for us at this point in time, it's not necessarily helpful or practical to use it, because it does mean different things to different people. To some it means asking for more time for testing, to others it means to put regulations in place, to others it means until we know it's safe. So, although I think there are people who would prefer if we said yes or no, that we want a moratorium, we have decided that what we will do is focus on the actions that we believe need to be put in place. And that's what we've outlined in the report. So, why this report? Many of you in this room will have written reports. I think that this is, from what I can see, is actually a very well-educated group. And you will know that the information within will not always...